Hello, my name is Nicole Menendez, and I am going to be presenting on polycystic ovarian syndrome. Topics that I will cover include the etiology and background of polycystic ovarian syndrome, pathophysiology of polycystic ovarian syndrome, signs and symptoms of polycystic ovarian syndrome, recognition and screening for polycystic ovarian syndrome, as well as current and future treatments. What is polycystic ovarian syndrome? Polycystic ovarian syndrome, also known as PCOS, is a hormonal condition that affects a female's ovaries, which is part of the female reproductive tract. It affects about 1 in every 10 women and those who are childbearing age. PCOS can stop a woman's menstrual cycle or make them very hard to predict. It can cause things such as acne, unwanted body hair, and facial hair, as well as raise the risk for other health problems, including diabetes and high blood pressure. So, I want to talk a little bit about the anatomy of the ovary and what the ovary's function within the body is. So, ovaries are walnut sized paired organs, which means there are two located on either side of the uterus within the pelvic cavity of a female. The surface of the ovary is covered in a thin layer called the germinal epithelium, and the thick layer beneath that epithelium is called the tunica albuginea. And I know that I'm probably butchering that word, but I did the best I could. So the tunica is consisted of a dense connective tissue layer, and that is the body of the cortex of the ovary. So within the cortex is where the follicles of the ovaries will reside. So these follicles develop in various stages until a woman hits their ovulation phase of their cycle. And once ovulation occurs, they rupture and they form into something called a corpus luteum. So the corpus luteum secretes a hormone to support a pregnancy if fertilization occurs. So, what is the function of the ovary? So, the ovary has a few different functions. The first would be the oocyte production, which is the female egg. So, the production of an ova occurs within the ovary, and once the ova matures, they are released into the fallopian tubes during a process called ovulation. There's also hormone production. So, the ovary produces two main hormones, including estrogen and progesterone. Both of these play a critical role in the menstrual cycle and the development of secondary sexual characteristics. And there's also aromatase production. So, what this means is the ovaries convert androgens, which are male sex hormones, into estrogens. The ovaries play a fundamental role in reproduction as well as the production of these hormones. So, ovaries are critical to the reproductive health of a female. So, the signs and symptoms of PCOS can be pretty broad. I've listed a few here. So, one of the main issues with PCOS is excess male type hormone production in females, enlarged ovaries, changes in ovulation, cystic ovaries, insulin resistance, acne, fertility issues, excessive body hair, male pattern baldness, weight gain, irregular cycles, depression, and pelvic pain. So, as I mentioned, since these hormones are tied to a female's menstrual cycle, there tends to be a lot of issues once PCOS develops. So, women might experience infrequent menstrual cycles, an absence of a menstrual cycle for an extended period, heavy or prolonged menstrual bleeding, hyperandrogenism, which is an excess of those male type hormones. So, this is going to lead to the excessive hair growth on places such as the face, back, chest, or other areas where men would typically grow hair. There's also going to be an increase in acne or severe oily skin, as well as alopecia, which is thinning or male pattern baldness, and polycystic ovaries. So, this is kind of the cardinal sign of this condition. Cardinal sign meaning this is the diagnostic indicator of this condition. So, what we'll see on typically an ultrasound is enlarged ovaries containing multiple small cysts, and they're kind of described as a string of pearls type presentation. Patients with PCOS will also experience metabolic issues such as insulin resistance, which is basically a reduced sensitivity to insulin, which can lead to higher blood sugar levels and potentially type 2 diabetes down the line. We'll also see weight gain in these patients or difficulty losing weight. And this weight gain is typically unexplained. So, this isn't a patient that is overeating, taking in large amount of calories. This is a patient who is continuing their normal nutritional intake and experiencing weight gain despite that. And their weight gain is particularly around the abdominal area. We'll also see dyslipidemia, which is abnormal cholesterol levels, including high triglycerides or low HDL. So, HDL is the good type of cholesterol, and we typically want to see those numbers higher, whereas with triglycerides or other cholesterol levels, we want to see those numbers lower. These patients will typically experience fertility issues as well, um, kind of tying back to those irregular or absent menstrual cycles. So, patients with PCOS will have difficulty conceiving because of those irregular ovulation or anovulatory cycles, which means ovulation did not occur. We'll also see patients experiencing a lot of psychological symptoms as well, such as depression, anxiety, mood swings. And this really ties into a lot of the physical presentations of this condition. So, women experiencing increased hair growth throughout their body can lead to a lot of self esteem issues, developing into depression, the anxiety, etc. And we also see patients experiencing sleep apnea or obstructive sleep apnea. So, what this is basically interrupted breathing during sleep. This is more common in women with PCOS because, again, we are seeing women that are having unexplained weight gain. And that tends to be a precursor or a contributor to sleep apnea. And we'll also see that these patients experience pelvic pain. So, this ties back into the enlarged ovaries, the cysts, and sometimes these cysts can rupture or they'll develop into these things called endometriomas, which can become very large and they're extremely painful. And oftentimes, women will require surgery for those endometriomas. So, polycystic ovarian syndrome affects about 5 to 10% of women. So, we're dealing with a relatively large percent of the population, and there are reports that about 70% of the women who are experiencing PCOS are actually undiagnosed by their providers. So, I want to talk a little bit about why it's important for women and just the healthcare community in general to be aware of this condition. So, polycystic ovarian syndrome is associated with a large variety of long term health problems that affect physical and emotional well being. So, 50% of women diagnosed with PCOS will eventually go on to develop type 2 diabetes by the age of 40. So, this is an important talking point because, like I mentioned before, about 70% of women that have PCOS are often undiagnosed. So, we have a large population of women who are at high risk for developing severe endocrine disorders such as type 2 diabetes, which, as we know, holds a lot of long term health ramifications. So, research has shown about 25 to 30% of women with PCOS will show impaired glucose intolerance. So, what this means is that these women are developing insulin resistance. So, insulin resistance is a precursor to developing type 2 diabetes. So, it's something that women definitely want to monitor, and hopefully, they get this diagnosis relatively early on so that monitoring and treatment can occur relatively quickly. And there's also statistics that show 60% of women with PCOS are obese. So we have these two factors in play here. So we have insulin resistance really tied in with this obese statistic. And so these women are extremely high risk, again, for developing type 2 diabetes. So, diagnosis of PCOS is a little bit complicated, unfortunately. Typically, diagnosis involves a combination of clinical evaluation, medical history, a physical exam, blood tests that measure hormone levels, and imaging, such as ultrasound, to visualize the ovaries. When we start doing these diagnostic testing, a lot of these tests are really based off the symptomology of these patients. So, treatment options are tailored to addressing an individual's symptoms. And I can get into that here in a little bit. But I do want to point out that as far as diagnoses from these patients, not all patients will have all of the symptoms that were listed. A patient can have PCOS without having cysts inside of their ovaries. So, there are multiple blood tests, such as the androgen test that can tell whether a female is producing higher level of androgens than normal. Again, and those cholesterol, triglycerides, and a patient history really to tell whether their menstrual cycles are regular or abnormal. So I just really wanted to highlight the point that just because a patient doesn't have cysts within their ovaries doesn't mean they're excluded from this diagnosis. So, the treatment of PCOS, as I mentioned, it's really tailored towards the symptomology of the patient. There is no cure for PCOS, and the focus of treatment is really symptom relief. So, first, we're going to talk about lifestyle changes. Lifestyle changes are there to target and reduce the BMI of these patients. So, we want to get the BMI down so that they can reduce their overall body fat percentage. And that also helps with the insulin resistance and monitoring these patients' glucose levels. So, we're going to want these patients to increase their exercise, eat a healthy diet, and hopefully, by exercising and increasing a healthy diet, it will help with some of the psychological symptoms, such as the depression, etc. But we can also treat those patients with antidepressants to help with the anxiety and depression. For women that experience irregular menstrual cycles, providers will often prescribe hormonal contraceptives. So, what these do is they kind of regulate and supplement those hormones throughout the cycle and help these patients maintain a regular menstrual cycle. And hopefully, they will continue to have a regular period. And I say that because what happens with patients that aren't shedding the inside of their uterine lining regularly, it puts them at risk for endometrial cancers. Women that experience infertility due to PCOS have the option of using IVF treatment or other medications that can help initiate ovulation. And there's also the option of using a medication called metformin. Metformin is typically used as a diabetic medication, but it helps to regulate a patient's blood sugar. And there's been studies to prove that it also helps with the fertility of patients with PCOS. Thank you so much for allowing me to speak to you about polycystic ovarian syndrome.